Yes.
Good morning, Julianna.
Hi.
I'm Marilyn Pierce-Bulger. I'm one of the
Nice to meet you.
I'm going to be working with you this morning, and I see you came in for a pregnancy test.
Yeah, I took one, I want to say last Sunday, so about a week ago. I haven't had my period in a couple months.
Okay.
And we're pretty excited.
Very fun.
I just want to get it confirmed.
So the home pregnancy test was positive. Do you remember when that was? What date?
Let's see. So last Sunday, about a week ago, the 20-something.
Okay. So here's
19th.
Here's this month.
Okay. So
we're at the 25th.
The 15th.
Okay. And do you happen to remember the first day of your last period?
It was August 20th.
Okay. And are you having any symptoms of pregnancy?
More or less, I've just kind of been nauseous in the morning and been really tired lately, and that's about it.
Okay. Those are both really common things that we see early in pregnancy. Now, were you planning to get pregnant?
No. I think I might have just skipped a day on my birth control by accident.
Okay. So you're on some pills and forgot one?
Yeah, it happens occasionally, probably once a month.
I have women that's their story. Yeah, occasional missed pills, not unusual. So tell me a little bit about what your cycles are usually like. Do you have a period once a month?
I get one probably once a month. Occasionally I'll skip. It's usually if I miss a pill or something and it'll mess up my cycle.
Okay. And so the last period you're telling me you had, was that after a pill pack?
Yeah, that was after a pill pack.
Okay. Okay. So what do you know about early pregnancy?
Not a whole lot. I mean, that would make me probably around a month or so, and I'm not really sure what happens during that time. I know, it's okay to still drink, so I've been going out the last couple of weekends, so I wasn't really too worried about it.
Well, you weren't planning to be pregnant either.
No.
So you were just living life, I think.
Yeah.
So part of this visit is me just getting some information about your health history and other sorts of things that have importance related to the pregnancy. So one of the things I'd like to do is get a little bit more information about how you use alcohol, because I heard you say a minute ago that you were feeling like it's okay to drink when you're pregnant, and I'm just wondering where you might have heard that information.
Oh, well, I've heard that, alcohol's okay for the baby. Early, better than late when the baby's actually a baby.
Okay, all right. So I'm going to do a little art thing here for you, just really quick.
Okay.
Do you understand how your menstrual cycle works in general?
Kind of.
Okay. So here's your period when we're bleeding, and then the next couple weeks is influenced by this hormone, estrogen. And what that hormone does is it helps us build up a lining, and our ovary gets one egg that gets selected. And then if we happen to have missed a pill, for example, like you did, what happened is that egg probably did get released from the ovary as opposed to not getting released. That's partly how pills work, is they kind of suppress that ovulation. But when the hormone level drops, then the egg can actually pop out. And then in the normal cycle, this other hormone, progesterone, is the one that's in charge.
Okay.
And then if we don't get pregnant, we bleed again. We have a period. Okay? So in your case, missing that hormone, missing that pill, it may have been right at the time of the month when it was a critical time, and so this egg popped out.
Okay.
So if your period was August 20th, it's going to be a little odd for you because you were on your pills. And so we'll probably order an ultrasound at some point just to figure out exactly how far along you are.
Okay.
But for somebody who wasn't using birth control, it's the time when that egg gets released is about day 10 to 16 of that cycle. So it's about 10 days after your first day of your bleeding, and then that following week, sometime in there, you might have conceived. Now, the baby doesn't actually land in the uterus. This little teeny tiny multiple cell organism doesn't land in the uterus for another week. So it's floating around out there in space next to the end of your fallopian tube. And it makes its way into the uterus and then attaches around the 3rd week after your cycle.
Okay.
Okay? Anything after that that can influence the fetus, the embryo, can get to the baby at that point, including alcohol. Alcohol is such a common thing that we use in our culture that we don't realize that it's probably the most harmful substance that can influence an embryo or a fetus. It's actually worse for us, for a baby, than cocaine, meth, marijuana, tobacco. And so what I'll be doing is when we get this ultrasound information about when you actually got pregnant and when you had your last alcohol use, I can give you some recommendation at that point as to whether or not that alcohol may have had some ability to influence the fetus, the baby.
Okay.
Now, alcohol is what we call a teratogen, and that big word simply means that it can alter and kill cells. So at this point, we know you're pregnant. I'm excited you're pregnant. I want you to not have any more alcohol at this point.
Okay.
Okay? What I would like you to tell me is a little bit about kind of what your alcohol use looked like in the past.
Okay.
So in a typical week, how many drinks have you had that maybe contain alcohol?
Like mixed drinks or just drinks in general?
Whatever you were drinking. What is the usual thing you drink?
Well, occasionally after work, I'd go out with my friends and we'd have 1 or 2, maybe twice a week.
Mixed drinks?
Yeah.
Okay.
So probably 3 times a week we would drink 2 to 3 drinks.
Okay. And then in the last 90 days, how many times have you had more than 3 drinks on one occasion?
Twice.
Okay. Can you tell me how many drinks it takes to make you feel high?
About 2, 3, depends on what the drinks are.
Okay. Has anybody annoyed you by criticizing your drinking?
No.
Okay. Have you ever felt that you should cut down on the way you're drinking?
Well, now I do.
Okay. But not before we had that conversation. Okay. Have you ever had a drink first thing in the morning to steady your nerves or get rid of a hangover?
No.
Okay. So here's what I want to just show you. 2, 4, 6, 7. So for women, aside from the pregnancy issue, what low-risk drinking looks like for women in your age range or in any age range is to have 1 or less drinks up to 7 days a week. Ideally not every day of the week.
Oh.
So that means about 7 drinks a week or less is considered lower risk drinking. We live in a culture where more is better, right?
Yeah.
So we don't think about that, and most of us haven't gotten that message. I'm not going to be able to tell you whether or not there's been any kind of influence on baby until we get the exact information about, sort of how far along you are, and then I can tell you when I think things implanted. What's the date of when you had your last alcohol? Do you know?
I went to the bar last week. I work right next door to a bar that I normally go to, and I had a drink there.
Okay, and so today's the 25th, so that was last week during the work week?
Mm-hmm.
Okay.
It was a Thursday.
So that was probably the 19th.
Mm-hmm.
Okay. Here's what I tell women who have inadvertently maybe had some alcohol and then not realized that they were pregnant. I may not be able to tell you whether there's a problem with this pregnancy, and that may not be something we can identify for a long time, if ever. But I think it's really important that you don't drink any alcohol from here on out, and it sounds like you're willing to do that. Mm-hmm. I don't want you to stop going out with your friends, though. So, as soon as you're ready to tell them you're pregnant, whenever you want to share that news, get some have a non-alcohol drink with them, so that you can continue to have fun with them, but not be consuming the alcohol with them, because you could still do that.
Okay.
So let's see about, I'm gonna ask you some more health history questions and family history questions and things, and then we'll make some arrangements for you to get some prenatal care.
Okay.